Did Naman come back from school? Grandpa questioned Simran for the 4th time in 2 hours. Simran wondered what happened to Grandpa and shared the incident with her mother. Little did she know that as her grandpa is aging, he might have a disorder which needs a proper diagnosis and treatment. Hello, and welcome to the Connected Minds podcast. Today we will discuss a common, yet less talked about disorder called dementia. When thinking, memory, and reasoning skills get impaired to a point where they interfere with the day-to-day tasks, this condition is known as dementia. Some dementia patients have emotional instability and personality changes. The intensity of dementia varies from the mildest stage, when it is just starting to interfere with a person's ability to function, to the most severe level, when the individual must entirely rely on others for fundamental daily activities. Although there isn't one particular illness that causes dementia, many illnesses can. For example, memory loss is a common symptom of dementia, but it can have many different causes. As people age, dementia becomes more prevalent. Approximately 1/3 of all adults over the age of 85 may have some dementia, yet it is not a specific aspect of aging. Many people reach their 90s and beyond without displaying any dementia symptoms. Let us look at the symptoms and indicators for dementia. When neurons or nerve cells in the brain that were once healthy cease functioning, lose their connections with other brain cells, and eventually die, dementia signs and symptoms develop. While everyone loses some neurons as they age, dementia patients lose many more neurons. Some symptoms include memory loss, poor judgment, and trouble speaking and interpreting. Loss of interest in regular activities or events, and hallucinations, delusions, or paranoia are yet significant symptoms of dementia. People with intellectual and developmental disabilities can also develop dementia, and identifying its signs can be particularly challenging. It's crucial to consider a person's present capabilities and watch for changes over time that could indicate dementia. What results in dementia? Most dementia cases have unknown root causes, despite research linking some brain abnormalities to specific types of dementia. In a small percentage of cases, uncommon genetic alterations can result in dementia. Professionals categorize dementias according to characteristics they share, such as the protein or proteins accumulated in the brain or the area of the brain affected. Some illnesses resembling dementias, particularly those brought on by pharmaceutical interactions or vitamin shortages, may improve with treatment. We must shed light upon the kinds of dementia to diagnose the condition better. The most typical dementia diagnosis in older persons is Alzheimer's disease. Patients with Alzheimer's disease have tangles and plaques in their brains. Beta-amyloid protein forms aggregates known as plaques, and tau protein forms fibrous tangles known as tangles. These aggregates harm healthy neurons and the fibers that link them. Vascular dementia occurs because of damage to the blood arteries that feed your brain with oxygen. Blood vessel issues can result in stroke or have other adverse effects on the brain, such as destroying the white matter fibers. Problem-solving challenges, sluggish thinking, and loss of focus and organization are typical symptoms of vascular dementia. These are typically more obvious than memory loss. The frontal and temporal lobes of the brain's nerve cells and their connections break down in dementia of the frontal lobe, and this situation is called frontotemporal dementia. These areas are typically linked to language, behavior, and personality. Common symptoms impact speech, movement, behavior, personality, thinking, and judgment. Numerous circumstances can potentially cause dementia. As you get older, significantly beyond age 65, the risk increases. Dementia can affect younger people and is not always a symptom of aging. You run a higher risk of dementia if someone in your family has the disease. However, many people with the family history never experience symptoms, while many others do not. You can do tests to see if you have particular genetic mutations. Large alcohol consumption is long linked to altered brain chemistry. Alcohol use disorders are found to be associated with an elevated risk of dementia, particularly early onset dementia, in several significant research and reviews. We should also be aware of the complications that tag along with this disorder. Many people living with dementia eventually cut back or quit eating, which impacts their nutrition intake. They might eventually lose the ability to chew and swallow. The risk of choking and aspirating food into the lungs increases with difficulty swallowing, which can obstruct breathing and lead to pneumonia. As dementia worsens, it may become difficult to bathe, dress, brush one's hair or teeth, use the toilet on one's own, or take prescribed medications. For people with dementia, several everyday activities, including driving, cooking, walking, and living alone, might pose safety risks. Now let us learn about ways to control dementia. According to research, dementia risk increases with inactivity. While no known diet can lower the risk of developing dementia, research shows that those who eat poorly have a higher incidence of the disease than those who eat a Mediterranean-style diet high in fruits, vegetables, whole grains, nuts, and seeds. Social engagement and physical activity may help to prevent dementia and lessen its symptoms. Attempt to work out for 150 minutes each week. Purchase enough vitamins. According to some research, those with low blood levels of vitamin D are more prone to dementia, including Alzheimer's disease. Certain meals, supplements, and sun exposure all provide vitamin D. Manage the risk factors for heart disease. Diabetes, excessive cholesterol, and blood pressure should all be treated. If you are overweight, lose weight. Keep up a balanced diet or a Mediterranean diet, which is high in omega-3 fatty acids, often found in fish and nuts, along with fruits, vegetables, whole grains, and other nutrients, may enhance health and reduce your risk of dementia. Additionally, this kind of diet enhances cardiovascular health, which may help reduce the risk of dementia. Get a good night's sleep. Talk to your doctor if you snore excessively, experience periods of unconsciousness during which you stop breathing, or gasp for air. Also, practice excellent sleep hygiene. Correct hearing issues. Cognitive decline is more likely to occur in people who have hearing loss. Early hearing loss therapy, such as hearing aids, may help lower the risk. According to doctors, in about 20% of cases, we can try to reverse the symptoms of dementia. Therefore, treatment for dementia will concentrate on controlling symptoms, especially agitation and other emotional issues. There are definite advantages to being physically active, following a nutritious diet, getting enough rest, and spending time with loved ones. They might also lessen the signs and symptoms of dementias like Alzheimer's and others. Exercise has been shown to affect health positively and may lessen dementia symptoms. Together, we can help and take care of ourselves and our loved ones.